I'm so excited. This is part 2 of the stomach channel's point, locations, and function. If you have missed part 1, it's right there. Please watch it. It's from stomach 1 to stomach 30. This video is all about stomach 31 to stomach 45. So much to say about those points specifically below the knee because there's so many functions. So let's go. Hi, I'm Clara from AcuPro Academy, and I create acupuncture and Chinese medicine content for practitioners and students, making it easy to grasp and fun to learn. If you found this of value, please give me a like or even subscribe so you don't miss out on any future video. And now, let's rock it. Stomach 31 is at the lateral side of the sartorius muscle, on the line connecting the ACES or anterior superior iliac spine to the upper border lateral border of the patella. It's not an easy point to find. You've got to find the sartorius, but it's not too bad. It's at the level of the pubic symphysis bone as well. Stomach 31 is easy. It's all local musculoskeletal issues, specifically hip flexors issues or IT band being tight. Combined with gallbladder 34, it's fantastic. The next 3 points are going to be located on the line connecting the ACES or the anterior superior iliac spine, where her 2 fingers are on her shorts there, and then the superior lateral border of the patella. Makes sense? So you could see it from her 2 fingers, the ACES, to the superior border of the patella. Stomach 32 is going to be located 6 tsuen above the superior angle of the patella. Stomach 33 is 3 tsuen above, and stomach 34 is 2 tsuen above. So 6 tsuen, 3 tsuen, and 2 tsuen directly above the superior border of the patella. Stomach 32 and stomach 33, same thing as stomach 31. It's very local, musculoskeletal related. So super simple. When there's pain or issue in the leg, those are the great points. That's it. Stomach 34 is a fantastic point for acute stomach pain because it is the sheath cleft point of the stomach, which is a great point to use distal to the stomach. However, I would also add REN 12, stomach 36, and LI4 if there was a lot of acute stomach pain. If there was vomiting, nausea, then PC6 would be a great add-on as an acute issue. Obviously, you want to do a diagnosis after for chronic issue, but for acute, this is the best point, so make sure to use it. Stomach 35 is going to be in the eye of the knee on the lateral side because Neishi will be on the medial side. And it is located, stomach 35, on the lateral side of the patellar ligament on the knee. Does that make sense? Stomach 36 is 3 tsuen directly below stomach 35. And often in clinical practice, as you can see, like my finger, we slide up until we can't go further. That's usually also a helper in locating stomach 36. And it's 1 finger breadth from the tibia crest. Stomach 37 is 3 tsuen below 36, still 1 finger breadth from the tibia crest. Stomach 38 and stomach 40 are at the same level. If you remember, between the lateral popliteal crease, or the lateral side of the knee, and the lateral malleolus, that is 16 tsuen. So stomach 38 and stomach 40 are both going to be halfway, or 8 tsuen up, 8 tsuen down, halfway of the leg distance from the knee crease to the lateral malleolus. Stomach 38 is going to be 1 finger breadth from the crest, and stomach 40 is going to be 2 finger breadth from the crest. So a little bit more lateral. Makes sense? You could see that. Stomach 39 is 1 tsuen directly below stomach 38. And you see my boomer coming into play because, of course, he's very curious and he has to know what's going on. And stomach 41 is on the ankle crease, as you could see with the boomer in the picture, which I think is fantastic. Stomach 35, especially combined with extra point Neishi, which is on the medial side, is fantastic for any knee pain. Those 2 points together work really well, so make sure to combine them. Wow, okay, so this is the big kahuna, the massive rock star of the stomach meridian. Stomach 36. I mean, all of us in practice use it all the time, right? Stomach 36 is the commander point of the immune system. So it's great to boost the immune system, specifically combined with lung 7. It also expels pathogens, so it helps to get rid of the pathogen as well. It is also the commander point of the digestive system, which makes it always the best point to use when there is any kind of digestive system issues, combined with other points, of course. It is the Rossi point and the lower Rossi point of the stomach, which those two makes it very powerful. As you can see, it's a special point 10 times over. It can be used for maintaining health. It's a preventative point to use to maintain our health. So I want to do it every day on everybody. If you're facing up, of course, if you're facing down, that's a different story, right? It also is the only point in the body that tonifies both chi and blood. So what are you waiting for? Stomach 36, poke, poke, poke. Stomach 37 is the lower Rossi point of the large intestine. Lower Rossi points in general are going to be used for young meridians, and they are going to be used for excess patterns mostly. Stomach 37, because it's the lower Rossi point of the large intestine, is the best distal point to use when there is constipation, diarrhea, anything happening to the large intestine. It's great to combine it with stomach 25, large intestine 4, for better movement if there's constipation, for example, or to help with diarrhea, and stomach 36, because stomach 36 is the commander point of the digestive system. I use stomach 37 all the time during pregnancy because I can't use Li4. So stomach 37 is a very good point in conjunction with stomach 36 during pregnancy, because I can't use stomach 25 as well because it's on the belly, right? So this is a great point to use. Love it. Are you enjoying my graphics so far? Well, you can find them all in my AcuPoint Made Easy, an illustrated guide to all acupuncture points, and so much more. The PDF version has a lot of video links. You can download it on your phone, your tablet, your computer, and have it at your fingertips at any time. It has a great table of contents. The hard copy ships all over the world if you're someone that loves to hold a book and really enjoy the colorful part of my graphics. You'll find them all exactly the same as the PDF in the hard copy book. The feedback has been amazing. As you could see here, so many people have just loved the book or the PDF or both. So what are you waiting for? Click the link below and get your copy today. Let's get back to what we're talking about today. Stomach 38 is a distal point as well, and this one is for shoulder issues. So when there is shoulder issues, we have a lot of protocol we can use locally, but we also need distal point. And stomach 38 to use specifically on the opposite side of the shoulder that's affected is fantastic. Love that point for distal shoulder issue. As I said earlier, lower Rossi points are great to address excess patterns in the young organ system or meridian. So stomach 39 is the lower Rossi point of the small intestine. And the small intestine, we know, is in charge of separating the clear from the turbid. So it's more related to a lot of fluids. So stomach 39 is a great distal point when there is urinary issues that are due to excess, like urinary tract infection, for example, which would be excess damp heat. Does that make sense? Awesome! Okay, I know that stomach 36 is the rock star of all the points on the stomach meridian. However, stomach 40, I'm so excited. This is my favorite point of all meridians, of any points. When I teach my students, they always laugh because I get so excited about stomach 40 because I see how amazingly, oh, is that a word, amazingly? No, how it works so well for all my patients. It's incredible. So, stomach 40 is the best point for phlegm, any kind of phlegm in the body, and this is TCM phlegm. So visible phlegm would be cystic acne, cysts anywhere in the body, coughing phlegm, of course, having a lot of phlegm in the body, but also for invisible phlegm, such as anything that's going to affect our mind, not just foggy head, but anxiety, depression, bipolar, schizophrenia, any kind of mental disorders is going to have some form of invisible phlegm. So stomach 40 works so well. Specifically, I see it in clinical practice for anxiety. It is such a great point. I use it all the time. Also, it's the luo connecting point of the stomach to the spleen. And if you haven't watched my luo connecting point video, check it out up there. It is going to be blowing your mind so you can understand the luo connecting point better, because I know it was a big request and everybody really enjoyed it and the feedback's been amazing. So check it out. Yay! So as a luo connecting point, stomach 40 connects the stomach to the spleen. And so it is a really good point to use for digestive issues, specifically to balance blood sugar. So if there is blood sugar imbalances, specifically diabetes type 2, you have to put stomach 40 as part of your protocol. Amazing point! Taking a little pause here, a little breather, just to remind you that on my website resource page, I have tons of more case study, treatment protocol, foundation diagnosis courses, so much more for you to enjoy and to support you. Don't forget AcuProAcademy.com, tons of more researches. Researches? Well, I'm not going to edit that. Resources, not researches, resources. Although there are a lot of research on acupuncture. If people ask you, is there research? It's all over the internet. Just saying. And make sure to subscribe, like this video, and comment so I know you're enjoying my content and I keep getting more feedback so I know I can create more for you to enjoy. Let's get back to the stomach channel. Stomach 41 is a Jing River point, which makes it great to clear heat, specifically heat in the face like red eyes, canker sores in the mouth, constant hunger, bad breath. But what I love to use it for, or to see it used for, is stomach 41 is great for drop foot syndrome. So this is a local point for that. And of course you have to do other points, but this point you absolutely have to be part of a drop foot syndrome protocol. So on this video, I went backwards, just for fun. Stomach 45 is 0.1 soon lateral to the second toe on just the corner of the nail. You could see that. Stomach 44 is half a soon above the web margin between the second and third toe. Then we have stomach 43, which is going to be distal from the junction of the second and third metatarsal bone. And then we have stomach 42, which is on the highest part of the foot, or the dorsum of the foot. We have to watch for the dorsal pedis artery in there because you can feel the pulse underneath. So be very mindful when you needle stomach 42. And it is going to be between the two tendons, the digitorum longus and the hallucis longus, which basically flex your toes and your big toe. And those are the location of all the points on the stomach. Woohoo! Stomach 42 is the yuan source point of the stomach, which makes it a great point to clear stomach heat, like heartburn, acid reflux, bad breath, but also toothache, right? What I think is great too is it's great to be part as a distal point for facial paralysis, for example, Bell's palsy or post-stroke. And it can be used for edema as well. So lots of things for that, right? Oh my God, stomach meridian. Stomach 43 is a shoestring point. Shoestring have tendency to help when there is swelling or excess dampness in the body. So that's what stomach 43 does. It's great for bloating, facial swelling, edema, basically excess dampness that is going to gather as excess water and create swelling. This is a fantastic point for it. Stomach 44 is a yin spring point, and it is the best point to clear fire, excess fire, stomach fire, any fire in the body. This is a fantastic point. So acid reflux, heartburn, bad breath, high fever, infection, mania, feeling like, you're just restless and you can't sleep because there's all this excess fire, bleeding, like bleeding in the stools, any excess fire in the body, or if your diagnosis is excess fire, you gotta use stomach 44. Best point for that. Last but not least, stomach 45 is the Jingwell point of the stomach. As a Jingwell point, like other Jingwell point, it is great to use for fainting, coma, high fever, sore throat, and manic behavior. But what makes it different from all the other Jingwell points is stomach 45 is great to use when there's dream disturbed sleep due to overeating. So people that have a lot of big meals overeat and then they dream all night and it wakes them up and then they fall back asleep and dream again. So it's not nightmare per se, but they don't sleep well because they have a lot of dreams due to overeating. So that makes it super, super interesting point for that. Now let's do a quick review to showcase the best function of the stomach point from stomach 31 to stomach 45. Let's go. Stomach 31, 32, and 33, local musculoskeletal issue. Stomach 34 is the chi clef point, so best point for any acute stomach pain. Stomach 35 is at the knee and combined with Nei Shi Yan, it is great for local knee pain. Stomach 36, the big TCM rock star of the stomach, Meridian. Great to tonify chi and blood. It is the commander point of the immune system and it also expels pathogens. It is also the commander point of the digestive system for any digestive system issue. And because it's also the Rossi point and lower Rossi point, this kahuna makes it fantastic for maintaining health and preventative health. So use it all the time. Stomach 37, lower Rossi point of the large intestine, great for any excess in the large intestine. Stomach 38, best distal point for shoulder issues. Stomach 39, lower Rossi point of the small intestine, so great for excess damp heat in the bladder in general or urinary tract infection kind of things. Stomach 40, my favorite point. It is the lower connecting point from the spine to the stomach, so perfect to use as a protocol for diabetes type 2. But it is the best point for phlegm. Invisible phlegm, which means mental issues like anxiety, depression, bipolar, schizophrenia, etc. But also physical phlegm like excess fatty tissue, cholesterol, cysts, all that. It's a fantastic point. I love it. Stomach 41, best point to use for drop foot syndrome. That's a really good point to use. It is also a Jingweaver point as well. Stomach 42, it is going to be used as a UN source point of the stomach. So great for acid reflux, stomach, heartburn, stomach pain, canker sores in the mouth. Stomach 43 is the shoestring point of the stomach. So it's fantastic for any swelling in the body, bloating, swelling of the face, edema, excess dampness, specifically when there's heat. Stomach 44 is awesome. It's the yin spring point and it's the best point to clear excess fire anywhere in the body. And stomach 45, last but not least, Jingwell point. It is going to be used as a Jingwell point, of course, for fainting and for coma and for manic behavior, but mostly it is used for dream disturbed sleep for people that overeat and stay up all night with lots of dreams. And that's how we review the stomach points in less than 2 minutes. I hope you enjoyed the content today and found a lot of value into it. Please subscribe so you do not miss out on any future videos and watch those two here to have more content for you to enjoy and absorb. Have a fantastic day, and no matter what, keep rocking it using TCM.